Good morning and welcome to Living Sickle Smart with Sickle Cell Foundation of Minnesota. We are excited to bring this special month-long series of sickle cell disease, a public health emergency, and we have a number of special speakers for you. Today is no different. We have a special speaker that we will be bringing to you to talk about the CDC's Sickle Cell Disease Surveillance Project. So I want to introduce Mary Hulihan, who is a health scientist in the Division of Blood Disorders at the CDC, and we'll let her discuss understanding the sickle cell data collection program, and then we will talk and ask a couple of questions at the end. I'm going to turn this over to you so that you can show your slides, Mary.
Sounds great.
And there you go.
Awesome. Thank you so much, Ray. It's wonderful to be here today. So I've got my slides ready and I'm very happy to be able to share with you information about our sickle cell data collection program, which, as you just heard, is a surveillance system for sickle cell disease in some of the United States. So the objectives today are to help you understand what is public health surveillance, what is the sickle cell data collection program, why is public health surveillance for sickle cell disease important, and what's next for our sickle cell data collection program. So first of all, let's try and do some level setting so we're all on the same page when it comes to a definition for public health surveillance.
Mary, we can't see. Can we see your slides? Yeah, okay, thank you.
Okay, great. And so here's the definition. It's been around for a long time, and I highlighted and colored some of the words that I think are really important in this definition. So first of all, it's the ongoing systematic collection, analysis, and interpretation of health-related data that is essential to planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of these data to those responsible for prevention and control. And that's a lot of words, it's a long definition, but again, just to highlight a few of these. Surveillance is ongoing. It doesn't start and then come to an end. It goes for a long period of time. It's a systematic collection, meaning that the data that goes into the surveillance system is being collected in as close to the same way as possible by everyone who is sharing that data. There is analysis of that data. The data is not just being collected and sitting somewhere in a big black box. It is being analyzed and it is being interpreted. We want to ask questions of the data. We want to use the data to improve our understanding of the health condition. And to me, most importantly, that information then has to be disseminated. If we just sit and play with the data and answer questions, but never share those answers with others, there's no point to public health surveillance. And so at the end of the day, the goal is to provide information that can be used for health action by public health personnel, government leaders, and the public. And this is very important. It's meant to be used to guide public health policy and programs. So that information is really meant to be used to help change healthcare policy and programs in a way that benefits those who are affected by the condition being studied in the surveillance system. So for our purposes, that is to change and guide public health policy and programs to improve the lives of people with sickle cell disease. And surveillance is such an important piece of understanding sickle cell disease. It was actually one of the recommendations from the recent report that came out about addressing sickle cell disease, a strategic plan and blueprint for action. So this was a large, very comprehensive study that was written by a number of experts in all fields, and really took a look at what is going on with sickle cell disease and what is needed to improve sickle cell disease understanding, care, and healthcare policy. And one of their recommendations, as you can see at the bottom of the screen, was that CDC, the Centers for Disease Control and Prevention, prevention should work with states to develop a public health surveillance system. And this is our sickle cell data collection program. So, there's historical evidence of the need for public health surveillance in general, and then much more recently, evidence of the need for it specific to sickle cell disease. So what is the Sickle Cell Data Collection Program, or SCDC? So here are the objectives and goals of the program. You can see there's a lot of language from that public health surveillance definition to collect, synthesize, and disseminate data. We want to establish a health profile of the sickle cell population in the US. We want to track changes in outcomes related to sickle cell disease over time. We want to make sure that there's credible and scientifically sound information to help inform standards of care. We want to make sure that when people are talking about clinical recommendations, clinical guidance, that those are based in scientifically sound data. And again, very important, we want this information to be used to inform policy and healthcare practices. And at the end of the day, the goal is really to improve the quality of life and life expectancy for those living with sickle cell disease. So these are the states that are currently participating in the program. There's a total of 11. You'll see that there are 2 here, California and Georgia, that are colored in red. Those 2 states have been working with a CDC program in their state for a number of years, so they're fairly well established. The other 9 in orange are all relatively new to the program. In fact, it's just this year, just this fiscal year, that we've had funding to support all 11 of these states. So we're really excited that what we've been doing for a number of years in 2 states is now being expanded to many more, including the state of Minnesota. What does the sickle cell data collection program look like as far as data sources? So this is a program where all of the information that is in it already exists. We are not going out and creating new data systems or creating new data sources. So there are a lot of programs, there are disease registries where sometimes information is collected directly from individuals with sickle cell disease. Sometimes information, is new that is being put into a disease registry. Our surveillance system, on the other hand, is very much reliant on data that already exists. So newborn screening data, which state health departments already have from their newborn screening program, helps to populate our data system. We have information from hospital discharge, from Medicaid claims, from the emergency departments, from vital records. So we have death records from the states that are participating. And then we do have some clinical information from some of the larger sickle cell clinics in the states who are participating in the program. So information from all of those different data sources is pulled out of those sources for individuals with sickle cell disease. It is then all combined and put together so that we can have information about individuals from all of those different times that they have healthcare, that they are basically that they are touching the healthcare system. We're able to pull all of that information together in one place. The challenge with all of these different data sources is, while an individual may be represented in multiple ones, they're not connected in any sort of way. And so our SCDC system is really making that connection among all of these different pieces of information. And so why are we doing this? It's a hard thing to do. It's difficult to collect all of this information, but why are we going the effort route? Why are we going to the effort of creating these public health surveillance systems for sickle cell disease? And the answer is because it's really how we're going to learn more about the entire population, not just those individuals who are receiving care in a comprehensive sickle cell clinic, not just those individuals who are covered by one form of insurance or another, not just those individuals who are receiving care in the emergency department, but really the entire population of individuals with sickle cell disease. And this is one of the first or only opportunities that we've really had to be able to do this in the US. So our SCDC system allows us to learn more about people with sickle cell. It allows us to simply count the number of individuals rather than having to guess and estimate. So you can see here, again, California and Georgia are the two states that have been participating in this program for a long time. And here's some data that we've collected from them. So you can see we now have a really good idea of the number of people living in each of these states with sickle cell disease. We can look at things like how, who was insured by different types of insurance. So here we're presenting information about those insured by Medicaid. And not just were they ever a Medicaid beneficiary, but how long were they a beneficiary? Were there times when they did not have their Medicaid benefits? Were there periods of time where individuals were without insurance? Were there periods of times where they switched from Medicaid to private insurance or something along those lines? So it really allows us to better understand the population. Another reason public health surveillance for sickle cell is so important is we can really learn more about what healthcare looks like for sickle cell disease. So what you have here is some data, again, from California and Georgia. And they took all of those individuals that you saw on the previous slide and looked over a 3-year time period between 2016 to 2018 to see whether or not an individual ever had a healthcare visit with a hematologist. So this is not even necessarily a sickle cell specialist, but just looking to see if individuals had any sort of healthcare encounter with a hematologist. And this was really a way to start chipping away at, understanding access to care for individuals with sickle cell disease. And so on the left, this is the pediatric population. So those, young children, teenagers, were they ever seen by a hematologist? And again, this is over a 3-year period. And so you can see in California, about 3/4 of the children with sickle cell disease did see a hematologist over that 3-year period. In Georgia, it was almost 90%. But then when we look at the adult population, so the older adults, starting 20s, 30s, and going on up in years, how many of them were able to have a visit with a hematologist? And what you see is that those numbers drop pretty drastically. So in California, only about 50% of adults with sickle cell disease had a healthcare visit with a hematologist over a 3-year period. And in Georgia, it was about 2/3 of the population, or 66%. And the reason this type of information is important is it can help policymakers, it can help legislative folks understand perhaps where more healthcare, where more clinics for sickle cell disease are needed, where more resources, whether those are human resources or financial resources, could best be directed to help improve health and healthcare for individuals with sickle cell. And then finally, again, circling back to that whole idea of using this data to inform healthcare policy, what you have here is an example of an initiative that has taken place in California in recent years, where the groups in California came together and actually were able to use data from their sickle cell data collection program to show exactly where people were living who were having a hard time accessing appropriate and knowledgeable care for their sickle cell disease. So they took that data, took it to their state lawmakers, and were able to establish new sickle cell centers, and not only establish those centers, and this is specifically for adults, but also this bill provided funding for those centers for a certain time period. And so, this data, we were so happy. Certainly, it was not, there were many people involved in this, and it was a lot of effort by a lot of groups in California, but we were really happy to see that the data from our project could play a small part in helping to further this legislation. So what's next for the program? We have these 11 states, they're all working to collect data, they're all working to analyze that data and start making it available for people to use in ways to improve lives for individuals with sickle cell. But what's next? What's on the horizon? So we hope to increase the program to be more than the 11 states who are currently participating. What you see on the left is a map of the United States, and it's an estimate of how many people live in each state with sickle cell disease. So this is quite an old map at this time, but you can see the darker the states are, the more people there are living in those states with sickle cell. And then you can see on the right, the states that we have participating in our SCDC program. And hopefully it's quite clear that there are a lot of those states that are dark on the left that are not yet participating in the program. So we certainly hope that resources and funding become available so that more and more states can start participating in the SCDC program, so that we can really get a great understanding of what's going on across the United States for people with sickle cell. And as I said, resources are needed for that. We've been very happy to see that many external partners have found this project to be a good investment and something that they support. And so what I'm showing you here are just some examples from different groups that have gone to Congress, that have gone to legislators and shown their support for the program. And there are groups such as the Sickle Cell Disease Association of America, the American Society of Hematology, the sickcells.org group. And these are all products that they have put out and tools that they have used in their efforts to show their support for the program. And I will just wrap up today with saying that we hope that this is something you're interested in and learning more about. We put out a quarterly newsletter. It's called The Bloodline. And in that newsletter, we showcase new tools, new information, new products that are coming out from all of our SCDC states. We share information, if some of the states have gone and given presentations, we try to include information about that. If there are webinars coming up that the SCDC states are hosting, we include that. And if you too would like to learn more about the program and keep up to date with the program, there is a link at the bottom of the screen. When you go to that link, there you will see a subscribe button. You can click on that, share your email address, and you will have this newsletter delivered to your inbox every quarter. And if you're interested in reading the past newsletters, those are also available at the link. They're all archived there. So that is what I have for you today. And I just want to say thank you so much. I really appreciate being able to share information about this program. I think it's so important. I think it can really help in so many ways. And if you have questions, that is my contact information at the bottom. Please feel free to email or call me. And I would love to talk to you more about the work that we're doing. If you are in a state other than Minnesota or other than one of the states that are currently participating and want to learn more about how your state could possibly apply in future funding cycles, happy to talk to you about that. Just thank you so much.
Awesome. Thank you very much, Mary. I just want to say thank you for all of the work that you've done with sickle cell disease. I've known you for a couple of years, and I've known of you for even longer. So this is not something that you've only just started doing. And so we appreciate the commitment that you've had. And that's one of the focuses that we've had, that we'll have throughout the month of September, is making sure that the community is aware of the steps that are being taken behind the scenes in order to make things better for them in their interaction, their day-to-day and month-to-month, year-to-year interactions with healthcare systems. So with that being said, I saw that you had put a map up that has kind of the occurrence or suspected numbers in every state. One of the reasons that the surveillance program exists is so that we can update those numbers, right? So where exactly does funding come from? Where does that trickle down from? How come, and I should say, how come there's not more states receiving it?
That's a great question. So we are very happy to say that in fiscal year 21, and the fiscal years and the calendar years don't quite match up, but we're coming to the very end of fiscal year 21. For the very first time ever, there was congressional funding for our sickle cell data collection program. So we did receive $2 million. This comes from Congress. That's how federal agencies in general get the majority of their funds. It's congressional funding. So there was $2 million in the CDC budget for this program. Again, that's the first time that there has ever been congressional funding for this program. Prior to this year, we have worked with CDC's foundation. So it's a separate foundation. It's its own nonprofit that is able to partner with private organizations, with pharmaceutical companies, with private donors to solicit and provide funds to CDC for programs that are felt to be extremely important that don't yet have the congressional funding to support them, or that don't have enough congressional funding. So prior to this year, the majority of funding for this project has come through CDC Foundation. So Novartis, Global Blood Therapeutics, Pfizer, the Doris Duke Charitable Foundation, BioVeritiv, several different organizations have provided funding. This year, congressional funding, and we are awaiting the fiscal year 22 congressional budget to see what our funding line looks like for that program in the upcoming budget.
Fantastic. And so is expanding to other states dependent on the amount of funding, or is it a funding cycle that the other states that might be interested, they just need to wait? What does that look like?
Sure, great question. So it's dependent on both. Right now, the funding cycle that's for those current 11 states is a 3-year funding cycle. We're finishing year 1. We have 2 more years left in the project. So those, at this point, to our knowledge, those are the 11 states we'll be working with for the foreseeable future. If additional congressional funding does become available that would allow us to fund more than 11 states, we would put out a new funding opportunity to do so. And I will just put in a plug for our newsletter. That is certainly a way that we would make that information available if new funding does become available and there are new funding opportunities. It would certainly be made available, and as a way to get that information out would be through our newsletter for sure. But yes, so it's at this point, we're waiting to see what the future holds for us, and hoping that we have opportunities to expand the number of states.
Well, this is exciting considering that we are expanding the sources of funding. And so that, is one of my questions about, partner support. What does that look like? And so thank you for sharing that. Now, I just want to clarify for those that may be watching who are living with sickle cell disease and who are, have kind of watched the course of attention being given to sickle cell kind of start and stop and kind of expand and then wane and be smaller. But their day-to-day experiences are the quality of care as well. Does this surveillance project look at the quality of care as well as the quantity of individuals living with sickle cell disease?
So that's an excellent question. There are some aspects of the quality of care that are certainly captured in our data. A better resource for understanding quality of care is something more along the lines of a disease registry, where there's the opportunity for patients to report their own experiences, report their own outcomes. Where I see our surveillance system kind of fitting into that conversation is it is a means for highlighting outcomes, healthcare outcomes, really health outcomes that perhaps could be related to quality of care, providing that information to those researchers or those who are designing disease registries to know that that's an area where more information needs to be collected. So I don't think our surveillance system is the way to answer every question about quality of care. It is a way to highlight areas that certainly need further study, and that may be areas where improved quality of care could really make improvements in healthcare outcomes. And then our system is also a way, once changes are implemented, once changes are made, to see if those changes over a period of time are making improvements, are resulting in better outcomes. So I see our surveillance as kind of being the initial step of here's a problem, then not necessarily a part of collecting information and figuring out how to fix that problem, but coming back in to say, okay, you tried something, did it work?
So, and that's awesome, because as each state who is currently part of the project, you know, we want to make sure that we are empowering the community to be able to share their experiences and allow their data to be used in a healthy way. I know that the word surveillance can make people a little bit nervous and uncertain about the safety of their information and how that information is to be used. But I'll just wrap up by saying that, you know, when we want something for us, we also have to make sure that it's with us. And so that participation and that sharing of the experiences and the collection of the information that allows us to get the data and the numbers that we need to be able to report in order to get more funding, right? Because this is not just an overnight project. This is not just a couple of years. This is an ongoing journey that we're all on. And so thank you once again, Mary. We appreciate you and what you are doing at the CDC and you and your team. We appreciate, as the state of Minnesota, being able to participate in this program. We are learning so much, but we also want to make sure we are contributing a great deal as well. And then we also want to thank our other partners and sponsors. Minnesota Department of Health, Sickle Cell Foundation of Minnesota is partnering with them as the lead on this sickle cell surveillance project, as well as Bluebird Bio, who is one of our partners in the Living Sickle Smart series as well. So thank you once again. We hope that you'll join us for our other sessions. You can continue to follow us on Facebook, Instagram, LinkedIn, Twitter. Look for Sickle Cell MN to find us. You can also visit us on our website at sicklecellmn.org. Thank you very much, and we'll see you next time. Thanks, Mary.
Thank you.